Greetings viewers. I am Dr. Roy Kuruvilla, specialist orthopedic surgeon practicing in a private hospital in Abu Dhabi, UAE. I am doing this video to share some information about COVID-19, which is a coronavirus infection which is prevalent in the society today. COVID-19 is an infection by a virus of the corona group. It has a high contagion but low mortality, meaning the death rate is low compared to other deadly viruses. Why I started with a mask is because there are so many misconceptions about this disease, and many people, they just walk in the streets with masks in the impression that they can avoid contamination and they can escape the disease. Actually, many of it is misconceptions. We will explain that. COVID is an infection by a virus of the corona group. Actually, there are many coronaviruses. Maybe you have heard about SARS, severe acute respiratory syndrome, which became an epidemic in 2003 in Singapore and other developed countries. Later there was a MERS coronavirus, Middle East respiratory syndrome. This was also a group of the coronaviruses, and the current coronavirus is similar to the SARS-1, so they have named it as SARS-2. Corona is a group of viruses, as I said, and they have a halo around it, just like the halo of the sun, and that is why the name corona. The virus was identified by us as a causative organism of a disease called pneumonia in China. China reported it to the World Health Organization by the end of December in 2019. By January 17, they identified the organism as SARS-2 virus. By January 11th, the first case of death was reported in China, and on January 13th, the first case outside China was reported in Thailand. WHO declared it as a public health disease of international concern on 30th of January 2020. Now, it was initially known as China pneumonia. Now the WHO has renamed it as COVID-19 from February 19th. COVID stands for Coronavirus Infectious Disease 2019. Coronavirus is a group of viruses. They cause different infections in the respiratory tract, starting from mild running nose to severe respiratory syndromes, which can result in death also. Examples are SARS, MERS, and now COVID-19. They have 4 different subtypes: alpha, beta, gamma, and delta. They cause a series of illness. The severity varies from very mild to very severe and can even result in death. All the coronaviruses are zoonotic, meaning they spread from animals to man. But the spread from man to man is the matter of concern now, because that has resulted in such a big contagion of the disease, and it has spread to all the continents because of the man-to-man spread. It is thought to have been spread from an animal market in China, where probably the organism is the animal of origin is bats, but it was contracted to a man, and from him it was contracted to other men. Uncooked meat is probably the reason for spread. As far as we know, it started in China, but it has spread to almost all continents except Antarctica, and it has spread to almost 80 countries around the world, including India and UAE. Death has occurred in about 10 countries. As of today, as of 5th March, there are 92,886 cases and about 3,168 deaths. Death has occurred in almost 10 countries. Outside China, it was seen predominantly in South Korea, Iran and Italy. About 10,000 cases were reported outside China. About 80% of these are confined to South Korea, Iran and Italy. If you classify the whole disease and the number of persons involved, 82% is classified as mild, about 15% is classified as severe, 3% are critical, and the death rate is about 2.3%. The incubation period is about 2 to 14 days, meaning if I contract the organism today, within 14 days I may have no symptoms. So during this period I have the organism with me, and there is a chance that I can spread it, I can give it to another person. This is why the importance of the 14 days quarantine or isolation. On an average, 5 days the symptoms appear. It's 9 days before the pneumonia sets in, and it takes about 4 days for the change in CT scan to see the changes in the CT scan in the lungs. If you look at the spread, it's mainly by droplets, big droplets. Big droplet means the size is more than 5 microns. We have two different types of masks in the market. This is the normal mask. This can prevent objects more than 5 microns. This is a high precision N95 mask which can stop objects less than 5 microns also. There is absolutely no need for this because the coronavirus is going through droplets which are bigger. So there is absolutely no need for the high precision mask except for the healthcare professionals and the people who are involved with the patients. Normally this mask is enough, and again the mask is being used so that the spread does not occur from my mouth. If I have the infection and when I cough or sneeze, the droplets of my saliva go out to a distance of within 1 meter. So in order to prevent that contamination, I must use this mask. There is no point in another person using a mask who has no infection because this does not go through air. There is absolutely no air contamination according to the present guidelines. So somebody walking in the street having a mask, it's actually meaningless and it's not required. There is no need for such a scare. Using a mask, it's very important because when you use a mask like this, the contamination from inside goes to the inside surface, it doesn't cross to the outside. So when you discard, your hands should not come in contact with the inside and outside together. You should cover it and discard it properly. The main contamination, as I said, is through the droplet. What happens is when I sneeze or cough, the droplet goes and lands on a surface which is a table or a door or a doorknob. Any person coming in contact with those objects may contract the organisms, and when that person touches his face, hands, his face, nose or eyes with his hands, the organism gets inside the body. That is how the spread goes. So what we need to be aware is about primarily the hand hygiene. If your hands have contracted and you have it come in contact with the infected material, what you need to do is just wash your hands with running soap and water or 100% alcohol rub, whichever is available. You can clean your hands and you can be sure that the organism is destroyed, because this organism does not stay in soap and water or alcohol rub cleaned hands. And every surface that is coming in contact with the droplets need to be cleaned likewise. How we can avoid contact from an infected person is by avoiding the droplet infection by making the person wear a mask, or we can ask him to be in isolation so that the organism does not go outside. Whoever is taking care of an infected person should be taking such precautions. What are the symptoms when one contracts the disease? It's mainly fever. Fever for 100% cases. 75% people have cough. Some of them will have breathlessness, and like in any other viral infection, they can have generalized tiredness or abdominal pain or diarrhea. The main symptom is fever and cough. A mild running nose or a fever less than 37 degrees, there is no need for any concern. What you can do is isolate yourselves, self-quarantine, meaning use a proper mask to avoid contamination to other people. Take care of the articles that you use to avoid contamination. In a period of 14 days, if the disease settles down, that's it. No need to run to the hospital. If you take the statistics, if 100 people are contacted, only 20 need to be hospitalized. So remaining 80 can be treated at home in their own circumstance and facilities without a need for any medical treatment. What you need to do, just like any other viral infection, have a lot of warm drinks and normal food. But if you have severe infection, if you have cough and if you have breathlessness, immediately go to a hospital wearing a mask. You need to wear the mask so that you will not contract or give the disease to another person. In India, we have hospitals from the level of district hospitals and the medical colleges having special cells for coronavirus. In other countries, they have facilities in the government hospitals accordingly. Go to a hospital, they have their protocol to manage disease, and they will take care of you. So, how to stop spread, or how can I avoid myself from getting the disease? I will mention few points as precautions to be taken care of. First, avoid crowded places. Places like a bus station or an airport. Meetings where people come together, where everyone is in contact. One person, if the other persons are in the reach of 1 meter, if he doesn't know that he has an infection, he can contract it to others. So avoid all avoidable meetings. Avoid all journeys outside the country. Most important is a personal hygiene. Keep your hands clean by proper hand washing with soap and water or a hand rub. Now handheld hand rubs are available. You can even take one in your pocket. Go take it wherever you go. Do it as much as possible in order to avoid contamination. Whenever you think that your hands are contaminated or there is a possibility of contamination with a public place or anything, do hand hygiene and proper cleaning of your hands. If you have a person with you having cough, keep at least 1 meter distance with that person so that the droplet will not come and infect you. 1 meter distance minimum from a person with cough. Avoid handshakes, hugging and kissing. Cover your cough, very important. What you can do, suddenly when you have a cough or sneeze, use your elbow with the sleeves to cover the cough so that the droplet does not get spread. Or you can use a tissue. Use a tissue to cover your cough, and after you cough, dispose it properly without having contact with anything else. Dispose it. And avoid uncooked meat, because this is thought to be the primary source of infection. Now man-to-man spread is there, so this is not very much applicable, but still avoid uncooked meat. Nowadays we have guidelines about travel. Kuwait has already issued a travel ban for people who are coming from it's not a ban actually, it's a caution for people who are coming from the marked countries. You should produce a certificate that you have no coronavirus infestation. Likewise, many countries are following this. So if you have to travel, follow the travel guidelines. These are all the highlights that we have as of now. Again, I want to tell you something. There is no need for a scare. The death rate as compared to other deadly viruses for coronavirus 2 is much less. So COVID-19 is a disease which can be contained with our basic measures of proper personal hygiene and isolation of a disease. I wish you good luck. Thank you very much.